So before I start talking about international guidelines, I need to start with the German newborn screen study. Normally in Germany, German newborn screen is done for 17 congenital diseases. It's paid by health insurance. In 2018, Dr. Katharina Hohenfellner developed a pilot project. She incorporated 2 additional newborn screenings for cystinosis and also spinal muscular atrophy. The study was performed between 2018 and 2019. They used the same blood spot on the piece of paper taken from all the newborn babies, but for these to participate in the study, the parents needed to sign the consent. It employed common CTNS mutations. In Germany, they are covering about 75% of German patients. And again, participation was voluntary. So between during the study, actually duration, 257,000 newborns were screened, about 20% of newborns that born that time in Germany. One neonate was diagnosed with cystinosis. It's consistent with estimated incidence. What is important, the oral cysteamine was begun on day 18 of life, and after 16 months of treatment, the child has no clinical signs of renal tubular Fanconi syndrome. Obviously, this pilot study demonstrated that it can be a national screening framework can be used, and early cystinosis diagnosis is important to save from kidney involvement. After the study was published, a total of 3 patients were diagnosed with cystinosis, and it's the same. 2 of them started treatment at 18 days of life, but one mother was initially offered the participation in the screening pilot study. She did not sign the consent, and then eventually the child was diagnosed with cystinosis. So this followed, this study eventually was followed by 3 different publications in 2019 and 2022. This allowed to show some data to German government. So the government said, okay, we'll incorporate it in the program of regular newborn testing. But you have to develop the evidence-based guidelines for cystinosis. So Dr. Hohenfellner, in 2021, submitted a grant application named SELECT as 3 guideline for cystinosis, and the grant application actually was approved in 2022 with the support of German Society of Pediatric Nephrology, and this was followed by many other societies supporting this study. So the steering board consisted of Katharina Hohenfellner, Dr. Dieter Hafner, and Elke Bull. They are all 3 German doctors. The guideline, they established the guideline group. It involves, so this is just to show how important is international study and how much work and effort it takes. Network is amazing and it's very important. So there were eventually assigned 80 experts from 21 different countries. And we worked through Zoom. We had, usually we had in the US, we had morning meetings. We had to incorporate different time zones. So from Germany, time is 7 hours ahead from Texas, for example, and even 9 hours away from California, which is really a challenge because, and then Japan is 7 hours or 8 hours ahead of Germany. So really to incorporate everyone, for example, people from California who were in the study, or Dr. Trauner, she was the member, she had to get up at 5 in the morning to join us. I started at 7, then 2 p.m. was Germany, and then 8 hours later was Japan. So 10 p.m. for Japan. It worked actually very well. So we signed actually, we were allowed to sign to any different cystinosis study groups, but if we signed to too many groups, there were too many Zoom calls. So anyway, but we had 15 different groups of interest that we were the part of. Project time was 2 years. So it was really, we had to speed up because we did not, it doesn't sound, it sounds maybe a lot of time, but it's not really a lot of time, but we made it. So there were, the steering group was responsible for these points for project organization and so on, and working groups, which it was the members of these groups. We had to develop PICO questions. That's part of the study, and then we participated in Zoom meetings, and then a final approval meeting, some people were in person. And then we eventually, we had voting panel. We had to vote on any point for the proposal. And then we also had, after we were done with this work, we had external review process. So the working on the project, the deadline was September 2024. And we completed it. So German government asked so that we present the guidelines as evidence-based medicine, which incorporates clinical expertise, best evidence, we have to look for it, and patient values. Study used the PICO model. This model incorporates, well, we have to first identify the problem in each of these study groups, then intervention, what should we consider, then we have to compare different alternatives and the outcome. So this is just the representation of these 31, eventually we selected 31 PICO questions and then 10 non-PICO questions. We had obviously statisticians helping us looking through the answer and even designing PICO questions, because that was a challenge for many of us. Statisticians did an enormous job. So when we had all these topics that we assigned, then they had to do the literature search because it had to be evidence-based. So they found 5,374 records through database searching. So that's as much as you can find in cystinosis. And then they found 90 additional records through other sources. And then they screened 3,500, and they excluded some records, the numbers just to show you how effortful it was to really come to the final records. We eventually used 100 studies, and they were considered in the evidence synthesis. So what it takes, so what does it mean? The evidence, we had to look for evidence and then we had to do the recommendations. But the point is that we had to find the quality of evidence. So if we found, and there was score assigned to it as well, and a discussion. So, for example, high evidence in the verbal, in the recommendations, it means that we recommend, so we write these words, or we do or we don't recommend. So this is really the highest evidence. But moderate, probably we suggest some wording. So this wording means a lot. Low or very low, it is uncertain. So it can be considered, we don't know. We try not to write, we don't know, but can be considered. So this is quite weak, okay? And a final meeting assigning all of these evidences happened in February 2024 outside of Salzburg. And that all of us, we were lucky. It was a perfect weather. We all thought it was going to be a snowstorm. February, that's the time for snowstorms, but we had sunshine. So, and we spent several days there sitting and talking on each recommendation, and we had to vote. So we had to vote. 95% of people present, they had to agree to final wording, whether it's a strong recommendation or moderate. We voted. So the outcome is fantastic. It is published. And it has been published in June the 6th, really a month ago. There is a German guideline, consists of 162 pages. And during even the meeting in Salzburg, we already started writing together. So, but then it had to be completed after the meeting. And we have also 65 pages patient guideline, and different patient organizations, including CRN, were the members of this committee. So they supervised all wording on patient guidelines. So we have German version and English version, and this is all done. So maybe please get out your phones and take the picture of this, because it is still difficult to get to it. But I have to say it's fresh, maybe that's why. You have to know the address of website. And this website, it's German address. That's okay, don't worry. As long as you just put letter after letter, you will be on the German guidelines. And within the German guidelines, there is a guideline for English version. We still don't have, and Dr. Hohenfelder is working on English version of guidelines. But for the patients, English version is already there. So there is a separate, it's on the same website, but if you prefer, like it says to maybe easier for you, the lowest there, it's English version of the patient's guideline. So you can look it up. So I still need to show you how it looks. I checked, so all these addresses work. But don't get scared, you get first on this German guideline, and it's in German. But if you scroll down, you will see the page of agencies they were supporting the guideline. Look how many, tons of them. And so this is English version. I did some screenshots to show you what it means. So if you put this address, you are still going to open up German site. But again, don't worry, just scroll down. And you are on like the next page. And there you see in the lower part, it says Patientenleitlinie, patient version based on the clinical free guideline cystinosis. That's fine, you see it in English. And you just need to click on download. So the last one, click on download. And then you will see English version. So here you can follow English version. And again, it's kind of a copy of German version, and just English translation. Okay. And this is to show you how many table of content, again, 60 plus pages, and you can see, you can choose whatever topic is of your interest. I would like to give many thanks to Dr. Katarina Hohenfellner for sharing this presentation. She presented it originally at DIPNA. I just reworked on it and did it kind of my way. An international collaboration requires passion and generosity of all involved in the project, and it would be not possible without funding support of different organizations. Many thanks to German government for being attentive to the needs of patients with cystinosis and for funding the newborn screen study, leading to current guidelines. The project would not be successful without involvement and perseverance of Dr. Katarina Hohenfellner. Thank you. Any questions?